Hello and welcome to the Daily Debate Thursdays with Taghreed Hussein here on Nile TV International. Well, in every crisis we have its heroes. Every disaster we have its displays of sacrifice. Firefighters, for instance, race into the burning buildings while police officers place themselves into the line of fire. The soldiers themselves march into war. Now, amid the coronavirus pandemic, we have our healthcare workers are the fighters indeed on the line of fire. They sometimes become infected themselves. They are making sacrifices in order to care for every one of us. So on this special edition, Nile TV International will paying a special tribute to our angels of mercy, and we do have one of them with us on this important episode for tonight. And marking this sense of tribute, I'm really honored to have with us Dr. Freddy Elbaiady, who is the head of one of our NGO hospitals working day and night to provide health care. And we'll be talking about a tribute on behalf of the whole society. And on top of the list, of course, comes the head of state with a special recognition to the doctors today. And tonight we'll be talking about this important topic, the physician's duties, especially during the times of pandemics. Dr. Freddy, you'll be telling us more from the field itself. And the sense of recognition in itself is always something that would make us do more and exert more effort. Appreciation is always admirable.
Sure. At the very beginning, I would like to give a special tribute and greetings to the soul of our colleague, Ahmed Al-Lawah. He's a doctor. He passed away last week, dying from COVID19 after working with his patients. And I also would like to give special greetings to our colleagues who are now suffering from the disease in some intensive care units. And I'm wishing them a speed recovery so they can come back and work again and fight the disease with us. Really, it's a very good thing that the community and the government are recognizing the efforts of the healthcare workers. I'm speaking about all the team, the doctors, the nurses, everybody involved in the healthcare process. And these things actually appear in the time of need, in the time of the crisis, as you just mentioned. Mm-hmm. And it's good to see this appreciation. And appreciation is not only about financial payments. Mm-hmm. Or the doctors are underpaid everywhere in our state, but it's very good to have this emotional way of recognition and of appreciation to what the healthcare workers are doing, especially these days.
Yes. Concerning, you're mentioning underpaid, we do have a recognition also on behalf of the head of state for increasing the doctors' allowances. And it's not a matter of money, but a matter of recognition. Sure. Recognition is always something that would make us exert more effort, that would make us give more, that when we feel appreciated, it makes a difference.
Yeah, sure. As you mentioned, it's not about money. It's still the nominal increase in the doctors' salaries, especially in the public hospitals, yes, is not financial good payment, but it's a way of recognition that those people are actually deserving special recognition. And it's good that the President mentioned several times the tribute and the greetings to the healthcare workers. This gives them more power to work and more positive energy to help in their country in a time of need, especially that there are other countries now are calling for international medical graduates to come and work even without license or without any examinations there. So, but still, most of my colleagues I know, if not all of them, they are not thinking about leaving the country, especially in this time of need.
Yes, because they are our white soldiers, so they are giving the country, they are not leaving the country.
That's true.
And it is the sense of duty, and it is the sense of responsibility and the sense of belonging to Egypt.
Sure.
In the first place. Let me take from your words positive energy. We need it all these days, sure, and I guess doctors would need it the most. Yeah. How can we provide this sense of the moral boost and give doctors today this sense of positive energy to continue? In your capacity as a doctor yourself, how do you see that?
Feeling that not only the government but also the community is giving this positive energy actually help the doctors to take care of those who are in need. Mm-hmm. And I'm also calling the community people that to to avoid going to hospitals unless it's really needed, so that they can give space to other patients who are in more need, or critical need,
to be seen
by the patients.
Yes.
And they don't overload the hospitals with unneeded services these days. So it's good to see that these patients are understanding this, and we see kind of understanding, but it needs to be more widespread, and the community has to be more concerned, especially the coming days, so that they can give more space for the doctors to take care of their needy patients. And I personally, and I'm sure my colleagues, are receiving a lot of positive feedback from our patients and from our community people who are day and night are sending messages of encouragement and support. This is what we actually need the most these days.
Yes, the youth are our treasure. And how can we say that? How can the youth today actually help doctors carry out their mission? We need all segments of the society to share, but the youth are always more energetic and having this sense of enthusiasm to help.
I see one of the important fields that non-healthcare workers can share is raising the awareness of the community. My son, who is 15 years old, he had a project with his school that they went to some hospitals and they met with the patients, start to give them some healthcare awareness about how to do cleaning stuff and sanitizing stuff, and some information about the COVID-19. So it's good to have those kind of people and youth going and encouraging the community people about what are the safe measurements that they should take to avoid the spread of the infection. And this is the stage you are in now. We are trying to flatten the curve, as they say, or reducing the spread of infection as much as we can.
Yes, flattening the curve. What does it take to flatten the curve? How can we work on that? How can we have this sense of awareness to know what to do and what we should not?
Most important thing is everybody, what the government is calling is the isolation as much as possible. People avoid going and contacting other people. Yes. Because the most dangerous thing is that 70% of those who got infected by the virus, they have no symptoms. They don't show that they are sick. And those people are moving around and they are carrying the virus to other people. But those who don't have enough immunity, if they get the virus, they will be seriously affected. So they should understand that if you are not feeling sick, this doesn't mean that you should go around and move around freely. But because you can have the infection and you are moving around and carrying it to someone else who cannot actually tolerate the infection. So it's important that everybody actually stay at home as much as possible, even if the government is allowing some hours of freedom and movement around. But this should be actually for the very strict or very needy things that they should go for. Otherwise, it's better to keep isolated inside their homes for at least for the coming 2 or 3 weeks, so that the number of cases and of patients infected doesn't go up.
Yes, I guess no doctors a while ago have been like having it on mind that they are going to serve under such circumstances or in those conditions, serving during times of pandemics, exactly like soldiers are going and defending their country during times of wars. Inshallah, there are going to be memories,
we hope so.
And hopefully we will get out of this dilemma through the sense of awareness of the people, through their sense of determination, their love of this country. How does it feel to serve as a doctor during a time of a pandemic?
At least not in my lifetime. I haven't lived this kind of feeling before. And I believe most of the people living these days, they haven't actually experienced this in their lifetime, because it was a long time ago when they had the cholera, for example, as a pandemic, or even the SARS, what was not that widespread like the COVID-19. So I think it's unprecedented in our lifetime. But also it's a feeling of being proud that we are fighting for our country. As you just mentioned, as a soldier, he's fighting for the country. He's defending the patients from getting infected. And he's actually expecting that he has a risk of this. He might die for his country. And we don't actually feel it's we're not scared of death because we feel it's our destiny, and we are sure that we are serving our country, and at the same time we hope that nobody will be affected. We hope that this pandemic will end sometime soon, and we trust that we have faith that God can interfere in a miraculous way and end this.
Inshallah, it will end. And we've seen footage here of Egyptians who are giving their country also in a way or another. Industries today, like the spinning and weaving, has been directed into manufacturing masks.
Yeah.
How is it important to have the mask on? And they sometimes say, we all hear that it should be in a way or another correctly taken off, or else it
Sure.
would have viruses.
Yeah. It is very important, especially if you're going to a crowded place where you have contact with people, to wear the mask, and this will cover actually prevent what they call the droplet spread of the virus, and it's special need, especially for the healthcare workers. And it's good that I saw some business people and some people are donating for the healthcare workers to provide the masks and the protective tools, which actually now they are the most needed, because what we are fighting now is trying to reduce the spread of the infection, and this is an important thing, to reduce the spread of the infection. And of course, they have some measurements that how you wear the mask and how you take it. If you touch it with your hand, then you don't touch your face with them because it can be contaminated if you touch it, and you have to exchange it with another mask. But of course, it reduces the spread of infection if you are using it properly in the right way.
Yes, definitely it is. And we do have more than one precautionary measure in order to fight COVID-19. What are those measures that many people do not take care of, and you consider to be quite dynamic in the fight?
Sure. One of the basic simple things is hand wash with soap and water. This is a very essential thing, and actually it kills the virus if you wash your hands thoroughly for at least 20 seconds with soap and water. This is enough to kill the virus. You don't need special materials to do that. Of course, we use it if we don't have access to cold and water, so we carry some alcohol-based sprays or gel or whatever, so this can actually sanitize our hands. But if you have access to soap and water, this is enough to kill the virus. So the basic cleaning measurements is very important. Also, if you're going out and coming with your clothes, you have to get ready, put it in your washing machine. Don't put it with other things so you don't carry contamination. Because what's actually bad about this virus is that it's actually spread by contact. So if you are contacting a contaminated cloth and then you touch your mouth and your eyes, this will actually spread the infection.
Yes.
And most of the people now stopped shaking hands and kissing and hugging.
Yes.
This is it's a good, healthy, actually habit. I hope that will continue even after we get rid of the virus, so we can keep these healthy habits after that.
Yes. Maintaining healthy habits is also very important.
Yeah, sure.
And especially after the virus is going to end. To have this culture, the media definitely has a role to play. We have more than one hands-on in that respect,
yeah.
right?
Yeah, sure.
So how can we all join hands in order to keep the healthy tips even after the spread of the virus and after this fight ends? I mean.
Yeah, actually, you have the biggest role in the media is to spread this way of teaching. And as you mentioned early, the youth, the young people who can actually use their time. Most of the people now don't have schools or colleges to go to, so they can use their time to spread the awareness about healthcare habits, the healthy habits, how to do it. This will actually, the media, the young people, the healthcare workers, they can hand in hand join together in spreading this healthy habits awareness.
Definitely it is. Let us take the opinion of Dr. Reem Farid. She's a professor of clinical pathology at Cairo University. Dr. Reem is also in her capacity as the coordinator of the Blood Bank Committee of the Supreme Council of University Hospitals. Good day to you, Dr. Reem, and let us know from you about the sense of coordination concerning the Blood Bank Committee and the distribution among the Supreme Council of Universities and through the different hospitals, a very noble aim going on, and we salute you and we salute your efforts in that respect. Dr. Reem.
Hello, good day to you and to all. Thank you for inviting me. And actually, it's a very important issue. The status of the blood banking, as it is a life-saving measure, the transfusion of blood, and we had after the pandemic started, we had this shortage of blood all over the country, but actually the Supreme Council of Universities is right now having the coordination with all the university hospitals, which treats usually 60% of the tertiary care, which is of more need, in need of blood. Right now there were campaigns for encouraging people and making the awareness that blood donation is safe. It's not hazardous or decreases the immunity. There is a false belief that if you donate your blood, you will have low immunity, and this is not true at all. And actually, Dr. Freddy was just saying that during the teenagers and the people are having an ample time, so they can use it in the awareness.
Yes.
I encourage that this ample time, they can also donate blood. And actually, there was great response lately in Abu Rish donation site and other universities that people, after being afraid for some time, right now they are encouraged to donate more and more voluntarily, actually, which is actually a very good response, and I'm grateful for it.
Yes, I want you to give a piece of advice on how much this sense of donations, blood donations make a difference, how it can save lives. And what is really actually making headlines and what you were saying is that it does not ever affect the immunity, because people would be like afraid if they feel that it would lead to that. And this is a misconception. We need to stress on that. Like, if you donate blood, this is healthy. Among the healthy procedures, it will re-energize the immune system, isn't it?
Yes. Let's speak first about the safety of blood donation. Actually, it's safe. It does not transmit any infectious diseases. It does not transmit any viruses, because actually the measures that we are using in Egypt is a completely closed, sterile system. So it is safe for everybody. Concerning the immunity of the person after donation, actually the donation stimulates the bone marrow. The bone marrow is that part of the body that it's the industry for making the blood cells and the immunity cells. So we are actually encouraging the bone marrow to be more active, to be more productive. So it actually increases the immunity of the person and helps him to be more healthy.
Yes, definitely.
There is another issue that you raised, which is very good, that the value of blood donation. I just want to tell you a very scene that I want everybody to consider. Consider yourself, the children in the Abu Rish hospital in the blood transfusion unit that take blood every week. That the look of happiness when they see a blood bag coming for them. Usually children should be happy when they see a toy chocolate. But these children are that in need with 4 blood bags that they get so happy, and you see the smile on their faces when they see the nurse coming in with their blood bag to have. I think this might explain, this scene might explain how valuable the blood is and how it is life-saving to those people, and there is no other alternative yet for them except to have to take blood once or twice a week.
It will make a difference, and it will save lives. God bless you. Dr. Reem Farid, Professor of Clinical Pathology, Cairo University. We thank you so much for this phone that did highlight more about the role that is played by the Blood Bank Committee of the Supreme Council of University Hospitals, meanwhile, during the crisis, and how it works. Let's watch the upcoming report. We're going to see more of the efforts that are exerted on behalf of the armed forces, Egypt's shield to safeguard the nation. Let's watch.
اللهم أنت ربي لا إله إلا أنت عليك توكلت وأنت رب العرش العظيم ما شاء الله كان وما لم يشأ لم يكن ولا حول ولا قوة إلا بالله العلي العظيم. أعلم أن الله على كل شيء قدير وأن الله قد أحاط بكل شيء علما. اللهم إني أعوذ بك من شر نفسي ومن شر كل دابة أنت آخذ بناصيتها إن ربي على صراط مستقيم.
The armed forces held on Tuesday a conference that was attended by President Abdel Fattah al-Sisi, Prime Minister Mustafa Madbouli, and several ministers to highlight its contributions in the protective efforts against COVID-19 and the exceptional measures to alleviate the impact of the crisis. President al-Sisi checked upon the Egyptian armed forces elements and equipment assisting the civilian sector in combating COVID-19. Commander of the Armed Forces Supply Authority, Walid Hussein, stated that 2,000 biological devices were used to sterilize buildings, and that almost 9 tons of detergents are used daily in sterilization works by the Egyptian Armed Forces. The commander added that the Egyptian Armed Forces allocated 22 hospitals for quarantine and upgraded a total of 45 hospitals to receive civilian patients. The number of ventilation devices in Egyptian Armed Forces hospitals allocated to COVID-19 patients is 1,100. On his part, Chief of Staff Mohammed Farid stated that the Armed Forces allocates 15,000 hospital rooms across the country to possible COVID-19 cases in Egypt. He presented the equipment that would be used to set up field hospitals if needed, noting that the Armed Forces deployed 1,200 trucks to transport staples to governorates. The Chief of Staff also said that the Armed Forces is taking all necessary measures to inhibit the spread of the disease among members of the military, stressing that the Armed Forces is vigilant about any infiltration attempts by elements who would exploit the COVID-19 crisis. President al-Sisi thanked all state institutions for the efforts exerted amid the COVID-19 crisis, asking them to do more, and called on all Egyptians to stand together and unite efforts in the face of the challenge.
ويمر بيك الزمان وانت اغلى وطن وانت اعلى مكان ومهما كان الله وكل خطوه نصر ومهما كان انت مصر يا مصر وكل خطوه نصر قولوا معايا نعيش ونموت لمصر مصر مصر تحيا مصر.
So it's time for all the different institutions in the country to unite and to unite with doctors hand in hand so that we would be able to reach the shore. Shedding light on the state efforts in that respect, a sense of coordination. As we've heard from Dr. Reem and like initiatives for blood donation and more. What more initiatives could be really helpful? We do have here a very important initiative on behalf of the Ministry of Higher Education that binds doctors together under the title Be Ready. So always be ready to serve.
Yeah. I believe this is a time of everybody to join hand in hand with this crisis. Every effort is needed. All the institutions, you mentioned the healthcare, public hospitals, the Ministry of Defense, the military hospitals, the private hospitals, the NGO hospitals, every single healthcare worker is needed, and every single citizen is also needed. Everyone has a duty to do. Those who can help in raising education, raising awareness, those who can help in supporting the healthcare institutions, either financial support or donating protective measurements. And the government actually, I believe most of the steps that we're taking from the beginning were very wise steps. Most of them actually were heading to controlling and preventing the firing or the spread of the infection. And if a citizen doesn't have anything to do, at least if he stays at his home and doesn't move around, he's actually helping in the process of cutting down or flattening the curve.
The curve,
yeah.
Yes. More measures we have been praised by the WHO director who had thanked His Excellency President Abdel Fattah al-Sisi for his strong commitment and efforts in order to curb the spread of COVID-19. On his official Twitter account, the WHO director tweeted, "Thank you, President al-Sisi, for your strong commitment to stop coronavirus from spreading and also ensuring that the affected populations are receiving wide-ranging support. Great act of leadership and solidarity." Yes, this is the timing. It requires great acts of leadership and solidarity. On your behalf as the head of an NGO hospital, this sense of solidarity has been extended to your community even before the spread of coronavirus, which is very important to see the sense of community work and the sense of support to your community, to the people of Egypt. How can we encourage this sense of NGOs and civil society helping side by side by the state?
Yeah, the NGO hospitals have a different spread because, from as you said, before the crisis, they are actually, their main priority is to serve. It's not for profit, it's not for gaining financial gain, but it's mainly for service. So when there is a crisis or is a time of need, this motive of serving actually is even more greater. It's increasing.
Yes.
So I can see this in the hospital I'm in charge of, that more people are actually willing to serve. The people who are giving, all our medical staff are volunteers. They give part of their time, but some of them now, these days, are giving more time because they feel there's more great needs. So they are actually focusing more on the help. They are working 24/7.
You see, those are our heroes. We have doctors here volunteering at this entity and for free in order to treat the people.
Yeah,
it happened, yes, before the crisis, but during the time of the crisis, we need more of that. We need to encourage and salute those initiatives and this sense of giving.
That's true. Yeah. And from this program, I would like to give special greetings to not only my colleagues, to all our medical colleagues nationwide who are serving voluntarily, who are not actually looking for any financial gain, but looking for defending the people from getting any spread of infection of disease. So this is actually a great time of service, a great time of showing love in action, of showing our tribute to our country, the country who we love, we were raised in, and we are willing to serve and to defend it with our lives.
Definitely the spirit of all Egyptians. Dr. Freddy, tell me more about the day-to-day job, especially during time of pandemics. How can we alleviate the sense of fear? It's also very important because doctors play a great role in that respect.
Sure.
Exactly when the people, it's reciprocal, give a moral boost to the doctors to continue. It's also vice versa, calming their nerves, like taking good care of their mental health as well, because mental health during times of pandemic is very important to keep the morale up.
Sure, and it's not only to keep the morale up, but having this kind of feeling security or the sense of fear actually scientifically this reduces their immunity. If you have this sense of fear, it will reduce your immunity. But it's important not to be scared, but to be cautious, to take care. The virus actually is a very weak organism, and just having the right healthy precautions is enough to defend. It's very important to follow what the healthcare authorities and the doctors are telling the people to do. If they are telling them to stay at home, it's very good to stay at home. It's very wise to do this. And there is an important slogan that the doctors say that we are staying at work for you. Please stay at home for us. So if you don't need to go...
So that you would not overburden doctors and hospitals.
And you don't actually carry the infection to other people. So because, as I said in the beginning, that some people who actually have low immunity, the age people, the seniors, those who have diseases like cancers or diabetes, or
they
are vulnerable, and their immunity is very low. So if they got the infection, they might be in serious condition. So it's important that you don't affect them. You stay at home. You don't move unless it's very important. And if you have to move around, you should use all the healthy precautions so you don't get others affected.
Yes. Usually during this time of the year where we have like seasonal rhinitis and we do have sometimes headaches, other times we could like catch a mild cold.
Sure.
Panic then starts and everybody is just like roaming. Did I get it or not? So how can we like calm those curves, not only flatten the curves, but also the curve of hypertension? How can we flatten this curve as well?
Yeah, I get these phone calls every day and night. I've got these symptoms of cold. This is corona. So we have to calm them down and tell them that actually there are some, most of the symptoms of corona are severe symptoms. And if you have mild symptoms, it shouldn't concern you. Even if it was corona with mild symptoms, it will go away. So 70% of the population who get the virus, they will not be affected with any symptoms or just mild symptoms like common cold, and it will pass after that. So it's, you say like 6% maybe of the affected people who will be actually in critical conditions, who will need special hospitalization and intensive care units. But most of the people will be actually having mild symptoms. So if you don't have severe symptoms, you shouldn't be concerned, even if it was corona. So it will pass away. Just get rest and get yourself isolated, and it will pass away.
Yeah, and I like what you said, Dr. Freddy, that the virus is weak. So always remember that the virus is weak and that we could be stronger. Through following the measures and taking the precautions. So this would also give us a moral boost while we are continuing in a way or another. How can we win the fight at the end of the day is a big question mark. And how to make it happen? Is it only through our sense of perseverance and determination and solidarity that definitely it is, it should be, with the different state institutions, with the great effort that has been exerted, but the citizens also have a very important role to play as well.
It has actually if you want to win the fight, all the team should work, and the team is not only the healthcare workers, but everybody inside the country, the citizens, the government officials, the healthcare workers, everybody should play his role. If you are playing a football game and one player is not playing his role, the team will be defeated. So everyone has a role to do. So it's not only those who are in the front line, like the healthcare workers, but every single citizen has his role to do in this fight.
Yes, and in the fight, we do have many roles. We have the role of the media. We do have also the role of soft power, because it reaches the people. People in times of crises like to listen to songs because it alleviates the burden and it alleviates the sense of stress. They would take care about their mental health. Some would like to dance, others would like to sing. There are also messages that are being sent through soft power and through songs. On your Facebook page, there has been a beautiful song that was directed to the people to flatten the curve.
Yeah, that's true.
Yes. How about that? It helps.
Yeah, sure. As you said, it's the soft power. And people like to listen to songs, and they learn a lot from songs. The meaning of the song, with the music, actually give the people some kind of teaching. So I would like to use this actually as a way of illustrations and teaching tools for the people on my Facebook page. For that. Yeah.
Yes, great, lovely way to flatten the curve. Let's flatten the curve, and let us enjoy this short break and see the message behind the soft power. Let us flatten the curve. It will be flattened as we work together. Let's watch.
Let's start at the very beginning. A sore throat, a cough in Wuhan. And in no time at all, there were 1, 2, 3. And one went on a plane, took it overseas. Overseas. Overseas, and that's how pandemics get started, you see. Woe is me, woe is me. Now we've got COVID-19. Oh, let's see if I can make it easier. Do not fear, but please stay here. Stay at home now, everyone. We must wash and clean things well. Cars, no long trips just for fun. Don't let COVID virus spread. Isolate yourself at home. See your friends online instead. That's the healthy way to go. Oh, oh, oh. Do not fear, but please stay here. Stay at home now, everyone. We must wash and clean things well. Cars, no long trips, just for fun. Don't let COVID virus spread. Isolate yourself at home. See your friends online instead. That's the healthy way to do not fear, but just stay here. Time to all self-isolate. Wash your hands, use lots of soap. Don't go further than your gate. Social life must stay online. Keep 2 meters clear of me. Watch TV, drink lots of wine. That will kill COVID-19. Cough in your elbow, wash your hands with soap. Now, children, staying at home and so on are things we do to stop the spread of COVID-19. Once you have this in your head, you can do 1,000,000 different things at home to stay sane, like this. Sleep, eat, whinge, tweet, snooze, blob, think. Sleep, eat, whinge, tweet, snooze, blob, think. Loaf, mooch, dose, smooch, binge, watch, drink. Love, mooch, dose, smooch, binge, watch, drink. Now put it all together. Sleep, eat, whinge, treat, snooze, blob, think. Love, mooch, dose, smooch, binge, watch, drink. Good. But staying inside is so boring. So we think about why. Remember why we're doing it. Like this. When you know the reason why, kill off COVID, stay inside. When you know the reason why, kill off COVID, stay inside. Eggs, tightly closed, and we'll beat this bug with speed. So your life has been postponed, and you're bored out of your mind. Suck it up and stay at home, and we'll leave this bug behind. Cough in your elbow, wash your hands, keep 2 meters away from me. Yes, please, I'm germ-free, and that's how I'd like to be. Keep away, please, from me. I stay COVID-free. Yes, please, I'm germ-free, and that's how I'd like to be. Keep away, please, from me. I stay COVID-free. Germs, I'm germ-free. Stay away from you. Stay inside your bubble now. Do not spread those germs around. Yes, you might be going mad and be desperate to get out. It's a nasty world out there. Keep the social distance rules. Everything you touch, beware. You can spread more germs. You have got the power to flatten through the
So let's flatten the curve, and we did flatten here our way. As we can see that songs can like relay the message in a beautiful way. Well, more than one advice was there in the song, like different precautionary measures that we could take in order to avoid COVID-19. Dr. Freddy, let me ask you about our immunity, how to keep our immune system in shape. I know some tips concerning vitamin C and eating fruits and vegetables, and because each one of us is very keen today to take good care of what we eat. Your health is in your food. So what are more suggestions that could help in that?
Yeah, it's important also to sleep well, and because having enough sleep actually raises your immunity. If you don't get enough sleep, this will affect your immunity. So sleep well and eat well. Eat well doesn't mean that eat much, but eat healthy food. Eat vegetables, full of food full of vitamins. This will actually raise your immunity. And also keep yourself in a good spirit. As I said, there's the emotional status and the lack of fear. This actually raises the immunity. It's part of our immunity system. Actually, is affected psychologically. How we behave psychologically affects our immunity. If we keep these basic things, I believe we'll have a good immunity. Yeah.
Yes, that's great, and we should care about our sleep hours, and having enough rest definitely makes a difference. Communicating with simple people in a simple way so that they would know about how to fight COVID-19 is also very important, and you deal with that on daily basis.
Yeah.
At the NGO hospital. So how is that? How are they receiving the advice and applying it?
I believe these days everybody is ready to receive, because everybody is concerned, everybody knows about it, and some of them actually are scared from it. So it's good to calm them down and teach them how to get protected, how to have good immunity, how not to spread the infection. And I deal in our NGO hospitals with most of the people are simple people who are not highly educated, but they are actually, most of them are willing to learn, willing to listen, because they are actually looking for that. They are looking for any advice or any sincere advice that will keep them protected from this pandemic.
Yes. We do have lots of success stories from doctors on the line of fire, and usually when the time comes when people are released from the quarantine and they are treated, this is considered to be a moment of victory. Exactly like raising the Egyptian flag during the time of war or during battles. So hearing also from your different colleagues who are there on the line of fire, what human stories did they tell you about this experience of treating COVID-19 and serving during times of pandemics.
Yeah, actually, the success stories is not only about treating, but also about prevention. How to protect their staff and their patients. And we are actually sharing together how to keep the protection measurements in our clinics, in our hospitals, not to spread the infection among the patients or among the staff. So we are actually experiencing this. So it's a great success if we are preventing the spread, if we are controlling how to sanitize the places. We are trying to keep this day by day. And I have some stories from colleagues who were able to diagnose some cases, and they refer them to the right places where they got treated. And as you said, it's like raising the flag when you see the patient is improving and he's free again. He's just giving them negative results, so he's free to move around and live his daily life again. It's a great encouragement for the doctor to see his patient is not a patient anymore.
Yes, definitely, that there is a sunshine at the end of the tunnel, as they say it. And talking to one of our doctors on the line of fire, and a big salute to all doctors today who are really giving and taking good care of us all. And Egypt's efforts to contain coronavirus are actually very much reassuring and resuming every day. His Excellency, the head of state, is following minute by minute the developments and giving directives to safeguard the lives of Egyptians as a first priority for the state now. Egyptians' health and taking good care of them is our first priority today. The President praised efforts made by the medical teams in their different specialities, giving their country. Many of them have actually refused to go out or to leave to serve in other countries because they love this country, and they are adamant to serve the nation, exactly like soldiers in the battlefield. Let's watch this report and we'll be back.
ويعكس شعورنا الحقيقي كدولة ومجتمع تجاه المرأة، زوجة كانت أو أما، ابنة كانت أو أختا، وكذلك تقديرنا وامتناننا للمرأة في جميع الأدوار التي تقوم بها على مسرح الحياة.
عايزه اي حد يتوسط لي المعرض، اخد عربيه وادفع عن الاصلاح، بس معيش معرض.
President Abdel Fattah al-Sisi ordered to boost the allowance of those working in the medical field by a 75% increase as a gesture of appreciation for their current efforts to contain the threat of coronavirus. The President's directions came during a meeting that included Prime Minister Mustafa Madbouli, Ministers of Defense and Military Production, Minister of Higher Education, Minister of Finance and Minister of Health to discuss the current situation. President al-Sisi praised the efforts exerted by the medical doctors and ordered to allocate £2.25 billion to boost medical staffers' allowance. He also issued a directive about launching a risk fund for doctors and workers in the medical field. The President ordered to issue exceptional rewards for the workers at quarantine, chest and fever hospitals. The President discussed the possibility of locally manufacturing medical supplies such as ventilators, amid the sharp shortage the world faces during the war against the novel coronavirus. al-Sisi has also discussed his government's efforts to have the Egyptians stranded abroad back into their country and subject them to the precautionary measures in order to make sure they did not contract the COVID-19 virus. Daily statistics updates transparently announced by the Egyptian government of the numbers of positive cases, cured cases and deaths reflect the seriousness of the efforts undertaken by all state agencies, with the aim of controlling the virus spread and dealing with all the health, economic and social repercussions of the current crisis. Since the beginning of the crisis, the state has established a Supreme Committee responsible for managing it. These multiple efforts earned the praise of the WHO. Following its visit to Egypt, the WHO technical mission announced that Egypt is making tremendous efforts to control COVID-19 in terms of early detection, testing, isolation, quarantine, tracking of contacts and referral of positive cases. The government, meanwhile, continued to exert great efforts to allocate additional human and financial resources to contain the pandemic.
Well, as before the report, we've seen also a very important role by the nucleus of the family, the mothers, who are taking good care of their children and their family during the crisis. So big salute for them as well, because they do help doctors actually in making their advice, doctors' advice, applicable in the families.
Sure. The woman role is very important in their families, and also I would like to greet the women in the healthcare institution, the female doctors and nurses, especially those who have kids. These days they don't have schools, so they have to leave their kids at home and they have to go to work. So those who are actually sacrificing their a lot of things to come and to do their work and to do their duty as doctors or nurses in the healthcare organizations. The women at home actually have a special responsibility, especially with educating their kids. They're taking care of the instructions of cleaning of the house, even if men are sharing in cleaning, but usually the women are leading in this instructions work, how to keep everything clean, and they have a special sense of doing that.
Yes, definitely a great big salute to Egyptian women who are actually working on the safety of their households and their loved ones and their families. The big salute tonight was also to the doctors on line of fire, and I think very much one of the angels of mercy with me tonight, Dr. Freddy Elbaiady, head of one of the NGOs, hospitals, working in Egypt and volunteering and working for free to serve the nation during those times of crises and during pandemics. God bless you, Dr. Freddy.
Thank you.
Bless our doctors.
God bless Egypt.
God bless Egypt. God bless the president. God bless the army. God bless our country, the Egyptian people, and definitely we'll flatten the curve together, and Egypt will be victorious over coronavirus very soon, inshallah. This is Taghreed Hussein. Many thanks for watching.